Now let's answer the question. Is the vaccine safe for children that are young? That's the question that is on a lot of people's mind. Is it even necessary for children that are young to get the vaccine? Because some people think they don't actually get as sick. Welcome to Dayspring Life and Health channel. So the FDA has come out last week to provide initial approval or initial use authorization for Pfizer COVID for children ages 5 to 11. Now let's answer the question. Is the vaccine safe for children that are young? That's the question that is on a lot of people's mind. Is it even necessary for children that are young to get the vaccine? Because some people think they don't actually get as sick. All right, so just so we answer that question, about 1.9 million children as of September this year have contracted COVID virus. About 1.9 million children have gotten the COVID virus. And some of them obviously ended up in a hospital. About 8,300 of those children had it serious enough that they had to be hospitalized and get serious treatment before they were resolved, before they were healed. So that is one reason why I would think that it is necessary for children to get vaccinated. The mere fact that you're getting infected and also spreading the infection. So even if you get infected and you don't die, but you give the infection to other people who may be more vulnerable, it is only wise that you get yourself protected so that you don't just spread the disease. Also, 146 children as of October 17th, 146 children have passed away due to COVID. Now you would say that 146 out of 1.9 million who were affected, that's not a lot. But if one of them were your child, you would see how important it is to get every child vaccinated. And also, some of these children are living with the long-term side effects of COVID. Some of them are having difficulty breathing, shortness of breath all the time. Others have serious muscle aches and pain. Others have chronic fatigue. So they wouldn't die, they may not die if they get COVID. But are you willing to put your child through long-term effects of COVID after they recover from COVID, when you could actually make it easier on them with a COVID vaccine? With a shot, even if they get COVID, those long-term effects don't show up. And as you know, children play together, go to school together, community of children all the time. So one infection in one child spreads like a wildfire as children play and associate themselves a lot in schools and games and all that. So it is important that children get vaccinated. Now let's answer the question. Is the vaccine safe for children that are young? The vaccine is safe on children, and at least for now the studies have proved. The FDA has shown that in the study that they reviewed, the vaccine was about 90.7% effective. It was shown as 90.7% effective against COVID disease, and it's also safe in the children that they studied from 5 to 11-year-olds. It is safe. As we all know, the vaccine had been previously approved and for children ages 12 and up, and they have been receiving this vaccine without any much serious side effects. As the FDA is continuously monitoring the children who get the vaccine. So once vaccines are approved, even those that were approved for adults, we still have ways of telling if there's any serious side effect that shows up in the future. So the same monitoring is going to go on for children. That's what I really want to say. So that if anything should show up, we will be told. But at this point, the vaccine has been studied way more than we should because it's been around for a while. Now, in children, again, people have the questions such as this mRNA is going to change DNA. In fact, that's one reason why some adults are hesitant, saying that it's going to change their DNA, and for that matter, they are not going to get the vaccine. The way the vaccine works, the mRNA vaccines in Pfizer and Moderna vaccines, they do not change any DNA. In fact, they enter the cell, and right in the cell cytoplasm, the message to make the protein is taken by your cells, and your cell makes the protein or to generate the immune response for COVID. The mRNA doesn't enter your nucleus, and after the proteins have been made, it gets degraded. So the mRNA that you receive in your vaccine, it doesn't stay in your body forever. It just goes in the cell. The protein that is needed is made, and it gets degraded. So it's not a permanent thing in you, and it's not going to go in your nucleus, a cell nucleus, to change your DNA or your genetic code or anything, as people suspect. Time have already shown that it's not really the case. It doesn't change your DNA, and it will not change the DNA of children. As we have already seen in adults, it didn't, and it's not. So it's not going to change the DNA of children either. And another proof, this is my own idea, if it wasn't degraded, it would continue to even make more antibodies, to the extent that you wouldn't even need boosters. The fact that we are needing vaccine boosters tells you that the thing that, the mRNA, that the vaccine that you got in your body that made the initial response is not there anymore. That is why at some point you need a booster. If it was there constantly changing and making proteins, there would have been no need for a booster at all. So that is another reason why you should believe that it's not changing your DNA, and it's not going to change the DNA of any children. What are some of the side effects of this vaccines that the children are going to receive? It's similar to the side effects that adults get. Injection site pain, which is normal. If you put a needle in the flesh, you're definitely going to have pain. Redness, also swelling, along with the redness sometimes. Fatigue, which also some adults have reported. Fatigue, headaches are also common, as well as muscle and or joint pain, which is also a side effect that adults have seen. And decreased appetite, it's another one. Also swollen lymph nodes and nausea. Those are the common side effects, which in my opinion are less serious compared to what a child would endure if they got COVID, or if they pass COVID to a grandparent or anybody who is immunocompromised. The side effects also are resolved within 1 to 2 days. Just like in adults, when you get a side effect and you get a shot, you get a day, maybe 2 of the side effects, and it's gone. And it usually shows up within 2 days. If you're going to get a side effect, you get it in 2 days, and 1 to 2 days, that's all it takes, and it's resolved. Does it affect fertility in children? And this question has come up over and over. Also in adults, the questions were was the vaccine going to affect fertility? And it doesn't affect fertility, neither in children nor in adults. So rest assured, no child is going to get any problems with fertility because of COVID vaccine that is approved, the Pfizer COVID vaccine. I hope it helps answer some of your questions. Don't forget that we do overcome this COVID virus together. The more people are vaccinated, the more we can return to normal. So if you want your life to be normal, get others vaccinated. Get yourself vaccinated, get your children vaccinated, let the kids go out to play, let life come back to normal. We can do this, people. If you are not safe, and somebody who could protect you says that because they can die, or because they believe they won't die, they are rather going to infect themselves and infect you because it's their body. Would you think that is a fair argument for you? All right, that's where we put video to an end. Beloved, I wish above all things that you prosper and be in health, even as your soul prospers. Thanks for watching.